watching WKBN 27 First News, where your news comes first in high definition.
Well, you probably know somebody who's had a cardiac stent, a procedure to open a blocked or narrowing artery. But a recent stent for former President George W. Bush is creating quite a debate in the medical community.
President Bush was having no symptoms, and some say the costly procedure wasn't necessary. But now doctors are debating how much testing is needed and when it's just initiating the cost of health care, inflating the cost of health care. So Salem family practitioner Dr. Michael Sevilla is here. As one of those doctors, he's been weighing in on this. He's had it on Facebook already. That's what brought my attention to it. And the other thing that brought my attention to it is President Bush and I are both in our 60s. Yeah. He's very active, riding his bike. I'm running and riding my bike too. Maybe because I'm that active, I'm overlooking things that I should be telling my doctor about. What should I notice in my everyday life here?
Well, people kind of know, and I get this a lot from my patients, you know, I know my own body, I know when there's something wrong. And, you know, when, especially people who are active, if there's something that is just not quite right, if they're having a little bit more shortness of breath, more than saying, oh, I'm a little bit out of shape, you know, or a little bit of chest pain. Or the other thing I tell my patients is, you know, you should know kind of what your risk factors are. Is there a family history of heart disease? Are you a smoker? Do you have cholesterol problems? Do you have diabetes? Those are things that people should be very aware about, and if there's questions, they should talk to their doctor about it.
So in my case, yeah, there was a family history of a heart problem with my dad. I'm 20 years older than he was, and I'm not taking any heart medication or anything like that. I'm just taking vitamins, and that's about it. So I'm still wondering what I should be looking for. Is there something I'm missing here altogether?
Well, the best thing is, and most people, especially guys, you know, they don't like going to the doctor, you know, unless they're sick. But for instances like this, I mean, you know, people, you know, should get their, you know, regular checkups with their physicians so they can talk about not only heart disease, but cancer screening or those type of health things that if you can catch that early, that you can treat it and get it appropriate.
So if you start having some of these symptoms and you go to your doctor, you say, hey, I'm having these symptoms, what kind of tests are they going to put you through to see what they're dealing with?
Yeah, specifically if you're having symptoms, you know, people always ask me about heart symptoms. You know, when do I need an EKG? When do I need a stress test? All that type of stuff. And, you know, that is something after you talk with your doctor, you have a physical exam, you know, you kind of see, you know, what your risk factors are, how high up, you know, risky are you? You know, are you overweight? Are you a smoker? Do you have cholesterol problems? Those are things that tempt to let your doctor know, hey, we should be a little bit more aggressive in testing and seeing what's going on.
We also know heart disease is a big issue with women. When it comes to the stent procedure specifically, are they getting them more than men, about the same? What kind of situation are they in?
I'm not sure about the specific numbers on that, but I do know that females have a little bit different symptoms than males, maybe a little bit more subtle. So maybe they're more apt to say, oh, it's nothing, you know, it's going to go away. You know, but especially for females, you know, they should get those, you know, symptoms checked out with their doctor, even if they're feeling a little bit off.
And what are some other tests that you feel are maybe being done too much that's inflating the cost of medical costs?
Well, I mean, I get this question a lot from my patients. They come in with a paper and say, hey, you know, my employer wants me to get all these tests, or I saw this on television. Should I get all these testings done? The best thing is to come in and talk to your doctor and see what your risk factors are, see what your family history is, to see, because some of these tests, you know, are not all they're cracked up to be, and they do add to the cost of medical care.
After getting a stent, what's the recovery like? We read that the former president, was out running and doing his normal activities a couple of days after being released from the hospital.
Amazing. Yeah, that's pretty typical. You know, it's not an unsafe procedure. I mean, it's a safe procedure. People are usually, you know, back to what they're doing in the next few days. But there's always medications, blood thinners, those type of things that you have to work with your doctor on to make sure that stent stays open.
So it's not just a stent. You do get medication along with it.
Absolutely. And regular checkups after that.
Okay, Dr. Seville, thank you for coming in with us for both hours of First News this morning.
Thank you.
More news and weather coming up after the break.
You're watching 27 First News with closed captioning brought to you by your local Ford dealers.
Two people with knowledge of Beau Biden's condition say the Delaware Attorney General is being evaluated at a cancer center in Texas.
Now, Beau Biden's wife and other family members, including his father, Vice President Joe Biden, are with him. The younger Biden suffered a mild stroke back in 2010. He began feeling weak and disoriented just last week after driving to Indiana for a family vacation. Well, you know, 2 weeks ago, former President George W. Bush had a cardiac stent procedure for a narrowing heart artery. Now, he wasn't having any symptoms, but his doctors recommended the costly procedure anyway.
And it kind of created a firestorm of opinions from doctors all across the country about medical testing and what's needed and what's just wasting money. Salem family practitioner Dr. Michael Sevilla is one of those doctors weighing in, and he joins us live in the studio this morning. Thanks for waking up with us.
Good morning.
You are obviously a fan of social media, and you use it to your advantage. Just kind of talk to us about what made you say, I want to kind of dive into this topic on social media with my patients.
Yeah, there was a lot of discussion when this story came out about President Bush and about his testing and about the stent that was placed. And when it first came out, a lot of people thought, well, this is a guy who bikes hundreds of miles and he seems very healthy, and why is he getting all this heart testing and why did he get a stent? But what's coming out now is that some of his doctors are going on the record and saying he was having a little bit of symptoms, and that's what we talk about as far as what is necessary testing, what is unnecessary testing, and that's what the big thing is now. Are we over ordering tests on people who have zero symptoms? And that's what the big firestorm was in the medical community.
In this case, the stent procedure is what, about $30,000? It's like, right?
Yeah, it's not a cheap procedure.
It's not cheap, right? Now, is it a preventive type thing? Because you're trying to what? Prevent a heart attack, right? And so you can have blockages or partial blockages and never even realize it? Is that how it works? Or?
Yeah, sometimes you can. I mean, most people who have heart disease don't even have symptoms, but for people who require stents, it's usually people who have symptoms, either chest pain or shortness of breath or dizziness or something like that. But when you talk to your doctor, is should I have this type of test? It should be individualized to what your symptoms are. Other things are what your family history, with your other risk factors. Are you a smoker? Do you have cholesterol problems? Those are things that you should talk to your doctor about.
Now, a stent obviously targets, what, one portion of the blockage. Is it going to protect you in the future from having a heart attack down the road?
Yeah, that's the goal of it, is that, when people start to have symptoms, if you see a blockage there, they put the stent in there to keep the blockage open. Now, that's only part of the solution. Patients are usually on, blood thinners for a number of months because we want to keep that open and not have it blocked up. If it blocks up, then you can get a heart attack from that.
Right, and actually, would medication be a cheaper method to do this, maybe, rather than going through the whole stent? Because it doesn't come with no risk either. A stent, there is a certain amount of risk to a stent procedure.
There is. I mean, it's sometimes you go to the groin area for that procedure. Sometimes you go to the wrist area for that. And also after that, people are on blood thinners, so people can get bruising and those type of complications. So it's not a benign type of thing. It's something you definitely need to talk to your doctor about.
Yeah, so many are done that people are treating it like it's not really surgery anymore, but it's surgery.
It is surgery, but the good thing about this type of procedure is, most people are, back to pretty much full activity in just a few days, obviously managed by their doctor.
All right, well, we will talk more about this in our next hour, and maybe some other tests and things that doctors are overshooting.
It's a big discussion point now.
All right, we're going to go over to Rich now with a check of the farm forecast.